Okay, good morning, good evening, good afternoon from wherever you are. My name is Pride Onyango Nyando. Welcome to the global webinar conversation. I'm a Kenyan by birth. I'm a student at USIU Africa pursuing pharmacy. But in Millennium Fellowship, I'm working on SDG number 2 and number 4. Ensuring that there is a quality education and also zero hunger. So the project that I'm working currently on, I'm working on zero hunger, and I'm working with the farmers in rural areas, and also I'm working with the meteorological department people to ensure that farmers know the right time to plant, the right seeds to plant, so that we can ensure that we eliminate hunger in our society. So I am a second year first semester student at USIU Africa. So it's nice to be here, and I would like to welcome all of you to this wonderful conversation. Our visitor will be Marion. She has not joined, but we hope she will join us. But before she joins us, I would like to invite all of you to introduce yourself in the chat box. Start with your name, the country where you are coming from, the SDG where you are on which you are working on, the SDG you are working on, and also you can tell us more about yourself in the chat box. I'm glad to host Marion. So Marion is Marion Subah is a health officer who dedicated her 40 years in the health field, and she's the last mile health country director in Liberia, where she manages organizations partnership with the Ministry of Health. She brings over 30 years of experience as a public health specialist and a program manager leading health system strengthening program across Liberia, focusing on reproductive, maternal newborn, and child health and human resources for capacity building for quality performance in the health place. So I can't say more about Marion Subah. She's here. I'm so happy to invite her here. Over to you, Marion.
Thank you very much. Like you said, I am Marion Subah, and I think you did an excellent introduction. So I don't think I need to say anything more about that. I just like to emphasize that right now, I work for Last Mile Health. And in working for Last Mile Health, I serve as the country director. And serving as the country director, I oversee our financial, technical, programmatic programs in Liberia. And so we'd like to thank you for inviting me. I feel very privileged and honored to meet all of you fellows. I also would like to thank Sam and others at Millennium Fellowship for this invitation. We thank the Millennium Network and the United Nations Academy for launching this, Millennium Fellowship. It has been a wonderful experience getting to meet people who are working for social change and social impact. We thank you for your commitment to lead with humility, and inclusion is always a wonderful time for me to speak to you fellows. I also want to congratulate you that out of over 25,000 plus applicants, we have 2,000 that have been selected. And so we would like to congratulate you again. As we look into this webinar for a few minutes, we want to look at social impact in terms of the donor support and how can we possibly set up a system for success. For me, being in the health sector for almost 40 years, I've been working to improve the lives of women and children. One of the things that I have seen is that I emphasize children. The thing about children is, like I say, they are the future. You know, I have a lovely poem. I'm sure maybe some of you have heard it. It called "My Name Is Today." Excuse me. In that poem, it says, many things in life can wait, but the child cannot. Children cannot wait because that is the time when they are children, even from 0 years, they are developing, their bones are being made, their blood is forming, their brains are growing, they are developing those emotional and psychosocial qualities that are needed in life. And so for them, they cannot wait. And I saw for UNICEF 40th anniversary, there was a key dedication on what are some of the things that happens with children. And it said, and that was for me the most impressive thing that have guided my life for a long time, that one of the things is that for these children, is that they found out that children from very low income settings, in terms of children who are even in slum communities and poor settings, these children, if they got play, if they got the correct health care like immunization, they had nutrition in terms of being fed right, like babies breastfed, they found out that these children had the same IQ level as children who were brought up in smart in communities with rich and elite neighborhoods. And from that time, I took it as a mantle to really look at what was happening to children. And I found out that if you work with children from the time they are 0, you will be able to move forward and get a healthy country. So for me, it's what I look at and what I want to do in terms of making a difference. We will have more children, smart children, who will be able to participate, who will be able to lead, not only in Liberia, but in Africa. And I always linked it to democracy. You know, if you don't have a childhood where you grow and aspire to choose and select and participate, you never learn. And so you come and we expect you to do democracy, it doesn't work. For the Millennium Fellows that have studied to become nurses or doctors, there's another question here. And who will want to integrate social impact work into their careers? What advice you have to give them? For me, that is like ultimately important. You know, a few years ago, I had he was like a former president. He had something that he called Center for Democratic Empowerment. And the only organization in town that had funding was UNICEF. And UNICEF said he wanted to get money from UNICEF. but he couldn't, because and the same thing that I told you earlier was that he came and I said, oh, but that's it. Children are connected to democracy. So if you want to study to become nurses or doctors or go into the science area, that is where social impact starts. Because it starts with people. Anything that has to do with people, there is something that is making them sick. So you want to be a doctor to help people. When you are interested into social impact, you will find that in communities, why are people getting? It's not only because they don't have the right food. It's not because they don't have the right hospital care. You will find that it may be due to some issue that has to do with social justice. You know, like we used to say, peace is caused by doing something to somebody or somebody doing something to you that's peaceful. And social justice is this whole thing of making sure we talk about people demanding health care. That's social justice. For them to realize that, for them to get immunization for their children, you are the doctor, you want to give that immunization. But you cannot give it because these people cannot reach to you because the road is bad, or you don't have the immunization even at the facilities. So social justice is working with people for you to be able to take care of them. You need to really do social justice is when you will get healthcare work. So it's not really separated, social justice and medicine or nursing. Social justice is doing your health work, doing it justice, doing it fairly, making sure that the patients get your right care and that they are able to learn what they need to do for themselves. And this is where I also like to talk a lot about self-care. And then one of the last questions we have, we know it has been historical hard for women to rise to positions where they can lead to create a change, particularly in Africa. Is there a challenge you face in your career? What are other big hurdles you had to cross over the years? It's true. One of the main things that happened with Africa is that if we look at Liberia, women are not like selected, young girls in communities are not the primary targets for school. So they do not get the chance to go to school. People keep daughters at home. So one of the things I always advise young girls is this thing about getting education. Advise parents about getting education for their children. The other thing is that, and when we talk about education, we're looking at both traditional education in terms of what do you learn in your village? What do you learn in your village? And if we talk about what are those things that you're supposed to learn that will make your life better, that's education. And as we promote the formal education to reduce literacy, we work on that. But I also emphasize this whole growing up and encourage people to ask questions, to learn wherever you are. You want to learn, you want to ask questions. You as a girl, and we as women, I talk about we as women, we have an obligation to lift girls. I always commend women in India. I went to do a public health program in India. And in that program, CHAMCARE is called the Comprehensive Rural Health Center. They were working with community health workers and they were working with illiterate women. And they only wanted women as community health workers. And these women learned but then they also were given opportunities to do things. And these women were the ones that brought the girls out. So they begin to do schooling for girls. They begin to do activities that will encourage girls. And as women, we need to be deliberate. And that's one of the things I want to talk about as barriers. If you sit, nobody will call you up. You have to get up and pull your chair, as I say, pull your chair at the table. But the way to do it is by education, by asking questions, and by other women, we as women, helping those girls that are down and not looking upon them and making sure that they get the right things. And we encourage people to take care of their girls and their boys equally. I don't know if you have other questions that you want for me to answer, but I think I will stop there.
Wonderful, nice. This was a wonderful presentation. Me, as a young doctor who is coming, I got inspired and I've learned a lot of things from this presentation. But I have a question to you, Madam Marion. You have said that you have been you have been ensuring, you have been campaigning or advocating for good health for women and children. Now, there is a problem we have, especially me as a Kenyan, we have a problem in this society where there is lack of information. People doesn't have got that information of good health. They have not been informed that this is the right food they need to take. This is the kind of water they need to drink. Did you experience such like a problem in the societies where you are working, and how did you address some of these challenges? That challenge of lack of information or ignorance in some of our societies.
Yeah, in Liberia, in the villages, before healthcare even came to villages, I will just give the example of nutrition. Every group in Liberia has some favorite type of food. And it's so amazing. They have a group that is called the Bassa people. They eat cassava. Some people call it yuca. Okay? They eat cassava, they pound it into fufu, and they eat it with soup. And they were doing it during the foundings of Liberia. But those people they did the vegetables, they will mash greens and garden eggs, eggplant, and different things, or benin seed, peanuts, and they will put it into that soup with fish. Nobody ever told them. They didn't learn it. And what I tell people is that the biggest thing we can do is to get into the community, find out what they do, how they do it, and then things that are wrong are things we want to correct. But before that, we want to commend them on that. So if I go into this group and I see them, they're doing this peanut paste, they're putting it into the soup and eating it, and then it's not for me to condemn them and say, why every day you are only eating this one soup? I need to taste it, and I will find that it's tasty, very wonderful, and I commend them on it, and I can tell them about other things to add to the food. So, in other words, I'm trying to say that if you really enter those villages, they know the information, the idea, the knowledge is there. We, with our Western culture, our knowledge, we have gone to them and have corrupted everything. When I was having children and I was in nursing school, all of nurses will say breast milk is the best milk, right? I'm sure most of you have heard that. But I will find that the nurses who are saying breast milk is the best milk, they were the ones who were feeding their children with powder milk or formula that they bought from the store. You see? So you have to be example. So you have to find out what they do there. I tell people, if this community was waiting for you, they would not be here. So they have been doing something good. And so I would like end to say one of the main things we need to do if we want to give people knowledge is to get in the community, find out what they do, look at the things that are good, commend them on the good things. The things that would not, it doesn't make any difference, do not bother with that. Things that are wrong are things that you want to correct, add, and you don't want to do it in a way that make them to feel like, oh, they don't know anything. They know a lot. And so we need to recognize that experience and the good things in these different cultural settings that we get into. They may be illiterate, but they have knowledge. And so we want to use that and want to build upon it. Thank you. I will stop there.
Okay, thanks for your presentation. It was a wonderful presentation and educative indeed. So it's time for Q&A. In case you have a question, kindly type it in the chat box, or you may raise up your hand, then we'll call you. So Mohammed Ekoroma, I can see your hand is up. Kindly ask your question.
Sure, yeah. So early on in your presentation, you were talking about building a system of success. What are some of the support systems that you use to rely on to help empower your communities and improve their health? Did you work with like government agencies or like healthcare agencies? What were like the modes of empowering the communities?
Thank you very much. For me, started off with government. And I think it's most important is a primary principle that I have in our organization and all the things, all the organizations that I have worked with is that we want to work through governments. So government fixes guidelines and protocols, and I think as NGOs, we go out to help them. So we work with government protocols, what they have, and try to implement the program. And then we get to the sub-national level where you have like county health teams or people in the clinics. It's like I have to get to them. But the ultimate persons that you want to work with is the community itself. So you are coming into the community and you are learning about them. In Last Mile Health, we have one of our core values. We say we are both teachers and learners. So those communities that we are going to, we go into them realizing that they have something, we can learn from them, and they can learn from us. So we go there, but you have to work. I don't think people should just step into a country and start to do something. Like some people think that they are most helpful if they can get there, but then you find out that it doesn't last. Because of course you will get tired, the money will run out. But if you can come and work through the government looking at protocols, I mean, it's difficult. I may be saying it like an easy, but it's difficult. But it's possible. And so if you're taking this thing from the government, what the government is saying, and you are helping people to implement it all the way at the community level, it's working. But don't like leave things out and say, oh, those people, the government, they are too difficult. They always want money, and so I'm not going to work with them. If you will find that you have a difficult time, or you come and you are able to do something for a while, and it doesn't continue. But if you are able to take those protocols and policies of government, work with the local authorities, then be sure that you are working with those people in that community, you will find that you will.
Thank you. Yeah.
A question in the chat on leadership and nursing. Let me see if I can get it clearly. Any suggestion to handle teaching and leadership together is from Kroma. Oh no, I'm not sure who is from. But teaching and leadership. My life is teaching. And I understand that when you are teaching, you are leading. maybe in short, I have to say that. A few years ago, I did a presentation. I worked with a group, and we're trying to train leadership from nursing training institutions, nursing and midwifery training institutions. And what we realized is that leadership, we made an acronym with the word leader, and we talk about leadership in learning environment, which is teaching. We call it about effective communication. You have to teach that. We talk about negotiation, assertive negotiation. We talk about using data. We talk about engage, in problem solving, that's leadership. And then the whole thing about resource mobilization in terms of this. And so when we talk about teaching, we say it's this whole thing of, sometimes people don't like to use the word, but it's manipulating all of these different activities and agendas together to get something going. If you are not a leader, it's difficult to teach because you have to take leadership of your class. You have to make sure that you use data. You have to make sure that you are prepared. You have to make sure, when we say data, we're not talking only about numbers. You need to know the students, who they are, what their goals. Those kind of things are also data. And you also need to make sure that you have resources, you can mobilize, and you can manage those resources well. So sometimes, I think one time I even had at the bottom of my email, teaching is leadership. If the past year, I have added this other thing to it that talks about you want to look at sustainability, that's the S. You want to have a heart to it, that's the feeling. You want to be innovative, and we know that's teaching. And that you want to do it in partnership. Everything you want to do, it's good. In Liberia, we said 2 years are better than 1. And so you want to do it in partnership. And then I came out, it's like ship, right? And I said, ship, that ship is the vessel that you need to get the leaders to elevate, to move, to be dynamic. So teaching, leadership, both of them are the same.
Okay, thank you for the response. Then Mohammed Koroma, you had got a question. I don't know whether you have fixed your internet, or you may type your question in the chat, then I'll read it. So he's saying, how has your work impacted those within your country, and what are some of the challenges along the way? From Mohammed.
I have my work. Okay, so presently I'm working in plasma health. We work in remote rural communities that are more than 1 hour walk from the nearest health facility. And I have to tell you that 28% of the population fits into that category. And so you want to make sure that you work with those people. What we have done, we have trained people from those communities to become community health assistants. So they are able to test if a child has malaria. They are able to check a child and diagnose if the child has pneumonia. Or they can get information from the parents to know what if the child has diarrhea, and they have the knowledge and the information to treat them. Also, so now they are treating, it's like very interesting was the other day, one of that between 2016 and 2020, 50% of malaria cases treated in Liberia were treated by those community assistants that were more than 1 hour away. And I'm telling you, 1 hour is like a joke. Most of them, they like 8 and 6 hours walk from the nearest health. So they are working with communities, they are providing that services. they are also like doing health education, encouraging people to the health facility for care. And they are also like for care for diarrhea because we're able to do health education and show them what kind of water to drink. So it's having a great impact to rural and remote communities. Now we have more women to deliver at the health facility, which we were looking for. And one of the best things I think is that over the past, well, since 2017 until now, we're able to actually reduce our maternal mortality almost by half. We came from 1,072 to now around 700 for the maternal mortality rate per 100,000 because of all of those things that have happened. So it's like things are going very well with that, and we're very happy about that. So it is making an impact, and even in the communities, you have people like we were out there last week talking to the community health assistant, and then people will come and say, want to tell you about this person. They are doing a very good job here. Now our children, they are not getting so sick. Children are not dying at the way they were dying in this village. So now we have more children in the village than what we had before. So we are like very happy with that, and we're hoping to continue and really look at other aspects where people will be able to not only seek care, but they will also begin to demand care, and they will begin to even look at self-care for themselves. So it is making an impact. Thank you.
Okay, thank you for the response. Then his last question was, you being a Liberian, how can Millennium Fellow of the University of Liberia get to you?
I don't know, it has a problem now. But anyway, like I was saying, I'm at Last Mile Health. Last Mile Health is on Tomo Boulevard when you are going outside of Monrovia. It's on the right. If you're coming into Monrovia, it's on the left. Is before you get to the new ministerial complex. It has a big sign on it that says Last Mile Health. For my email address, it's my first name, last name, Marion Subah at lastmilehealth.org. So like, maybe what I can do, put it, let me see if I can get to the chat, put it to the chat. But it's like on Tottenham Boulevard. Yes, I'll put it into the chat. Is my email is NSUAH at Steelers EALTH.org. That is my email address in the chat. And like we say, on Tottenham Boulevard, a good time to get in contact with us is like early morning. But in the afternoons, we are doing so many meetings with people outside of Montreal. So it's getting tough. But in the morning, we are available. If people want to stop by, or you can send me an email. So I want to really thank you all for the privilege of interacting with you, and wish you the best. And I'll be very, very happy to be in contact with you. Thank you very much.
Okay, thank you so much, Mrs. Marion, for this wonderful presentation. Where I'm sitting down here, I wish it would be a physical meeting. I think it will be more wonderful than this one, but I would like to take this opportunity on behalf of my fellows, at USIU Africa, Kenya as a whole, to thank you for taking your time and joining us in this wonderful conversation, and also giving us more, teaching us, and also guiding us on how we can go about health issues. Me, as a person, health is a problem in my country. So when I join this conversation, I've really learned a lot. And since I'll be working on SDG 3, I'll ensure that in my village I'll do something. And also, as I'm doing pharmacy, I'll ensure that I will do something to my society. Yeah, so I would just request you to share your details, your social media details, maybe if we can follow you on LinkedIn, Facebook, or Instagram, for maybe if we would like to consult you, where we can get you easily.
Thank you very much.
So thank you, fellows, for joining this conversation. I will appreciate your time. I know most of you are busy, most of you are students and you have classes, but you have taken your opportunity, you have created your own time to attend this wonderful conversation. I really appreciate. And I hope we'll meet in the next webinar, global webinar conversation. I'm so happy to be here to meet my fellow Millennium Fellows from other parts of the world. Thank you so much, and I would like to call this meeting for adjournment, and let's keep connecting as fellows. We need to encourage one another, how we can share ideas, especially if we are doing same SDGs, we can collaborate and we can ensure that we change this world. Thank you so much, and I would like to wish you a wonderful day for those who are in some countries, but here in Kenya, I would like to say good evening and see you later. Thank you.